Brow lifting is an extremely popular procedure in plastic surgery. Let's talk about it on today's case. Hi everyone, welcome to Aesthetic Minutes Clinical Vignettes. Today we have a 67-year-old female interested in lifting the eyebrows and forehead as well as in rejuvenation of the lower face and neck. She has no prior history of cosmetic facial procedures and is very healthy, without any significant medical history. Examination of the upper face helps us determine which surgical technique to use to achieve the best result. In this case, the physical exam reveals moderate ptosis of the brows and excess skin in the upper eyelids known as secondary dermatochalasis. The sagging of the brows combined with the excess eyelid skin makes this otherwise healthy and active patient look tired and even sad. Therefore, a brow lift is appropriate to consider in this patient since it will improve the position of the brows and help open the eyes. But choosing which technique to employ in this patient requires further consideration. Choosing which brow lifting technique to use to rejuvenate an aged brow depends on patient factors as well as patient preferences. In this case, in addition to a brow lift, this patient also wants to address the forehead lines, which have become etched into the skin over time. Permanently smoothing the forehead skin requires lifting the forehead as well, which demands a more thorough dissection from above. There are three main types of brow lift procedures that can lift and rejuvenate the forehead: the endoscopic brow lift, the coronal brow lift, and the trichophytic brow lift. The endoscopic brow lift uses 5 small incisions strategically placed in the scalp and then dissects the forehead and brow tissues under endoscopic viewing. The brow and forehead tissues are then lifted and suspended using small bone-anchored implants or sutures. This technique is very useful in most female patients in whom only a modest amount of lifting is required and in whom the hairline is low. Because no excess skin is removed in this type of brow lift, the degree of lifting is more modest and short-lived, though the surgery is less invasive. The coronal brow lift is a much more invasive type of brow lift compared to the endoscopic technique, and is designed for substantial lifting of the brow and periorbital tissues. Here, a scalp incision is made from ear to ear behind the hairline, and the tissues are then openly dissected down to the orbital rims. The forehead and brow tissues are then lifted up, and the excess skin is cut away permanently, creating a powerful, long-lasting lift of the brows. Because the coronal technique actually removes excess skin of the forehead and scalp, it tends to have greater longevity as well as lifting ability. Even though the endoscopic and coronal brow lift techniques would work in this case, they both cause the hairline to move back, which in this patient would be problematic. Ideally, the distance from the eyebrows to the hairline measures approximately 5 to 6 centimeters in the feminine aesthetic. In this patient, with a forehead height that is slightly greater than 6 centimeters, any surgical procedure that displaces the hairline posteriorly would carry the risk of causing excessive elongation of the forehead, resulting in a less natural appearance. As a result, for this patient, the trichophytic brow lift technique was favored. In a standard trichophytic brow lift, the incision is placed along the frontal hairline, extending into the temples bilaterally. The forehead tissues can then be dissected along different tissue planes depending on what the surgeon aims to achieve, to both lift the eyebrows and smooth the forehead. In a trichophytic brow lift, the excess skin between the eyebrows and hairline is removed, thereby reducing the apparent height of the forehead. Furthermore, if necessary, the surgeon can even bring the hairline down to correct a receded hairline. In this patient, a modern version of the trichophytic brow lift was employed, called the Endoscopic-Assisted Bi-Planar Trichophytic Brow Lift. In this technique, the same trichophytic incision is made along the hairline. However, the surgeon then performs a double-layer dissection of the forehead tissues. First, by separating the forehead skin from the underlying frontalis muscle, thereby completely erasing all forehead lines, and then by separating the frontalis muscle from the underlying bone through the same endoscopic technique used in the endoscopic brow lift, which releases the brows for maximal long-term suspension. Once the brows are lifted, the excess skin is removed, thereby shortening the forehead and, if necessary, bringing the hairline down. The endoscopic-assisted biplanar trichophytic brow lift offers the most complete rejuvenation of the upper face at the cost of a hairline incision, which typically heals very well. In this patient, in addition to the brow lift, a High-SMAS facelift with an anterior platysmal plication was also recommended for rejuvenation of the lower face and neck. Finally, to correct the moderate aging of the skin, a fractional carbon dioxide laser resurfacing of the face was also suggested for maximal rejuvenation. The patient underwent these combined surgical procedures under general anesthesia, which required approximately 6 hours of operative time and 2 weeks of surgical downtime. She tolerated the procedures well and recovered without any issues. Here are this patient's results 2 months post-procedure.